Welcome to the CE module, Defining Wellness and Well-Being, Conceptualizing Your Approach to Wellness. In this particular module, we'll be covering the following topics. First of all, context for wellness. Secondly, core concepts. Third, major definitions. Fourth, requirements for a good definition. One suggestion, some important implications, and then a closure with some summary of main points. Now let's look at some context for wellness. And first of all, the setting that we're focused on generally is the work site, but we also have school settings, home settings, community settings. So our definition of wellness is going to need to address and adapt to the population circumstances and the needs and attributes of each of these four settings. When we talk about populations and our issue in terms of our definition of wellness, our focus is oftentimes on employees. It can be also employees and spouses, but it also can be related to management at three levels: our senior management, our mid-level managers, and our first-line supervisors. In addition, we oftentimes want to think about the population of spouses and family members. So we may extend beyond just the employee in our perspective on how to define wellness. In addition, we have the issue of our target scope. Is our program going to essentially have a narrow focus? Are we going to keep it related to a specific goal, perhaps healthcare cost management? Or are we looking at well-being? Are we thinking about broadening our target scope to a very broad range of targets? So the definition sets the stage for our targeting. So these setting-related issues, population kinds of concerns, and target scope will have a lot to do with how we define wellness over time. Now, the core concepts of wellness we're going to go through briefly. First of all, moderation, so that we're avoiding extremes. We avoid those extremes and repeating those extremes over time. We might have the same extremes, but not do them as often. Personal responsibility, so the idea that I have some responsibility for my health and well-being. Holistic versus or multidimensional, meaning how broad a range of approaches and perspectives do I bring to human health, and how does that play out in the context of my wellness program. There's also the underlying core concept that we all are faced with choices. So each day we get up, there are new choices. What we eat, how we take care of ourselves or not take care of ourselves, what kind of substances we use, what kind of risk we take, what kind of connections do we seek with other people. So there are a lot of issues around our making healthy choices. And it's oftentimes quality of life oriented. So we may, in fact, include in our core concept of wellness an orientation to the quality of life that we experience. And that can be now, but also thinking about what am I doing for the quality of my life later in my life, perhaps in my 70s or my 80s or my 90s. Optimal health, so the idea that we are attempting to reach that point that's unique to us as individuals, that has to do with what optimal health I can experience as an individual. And the issue around the intentionality of what I'm doing. I need to do some things that are intentional to create a level of wellness and well-being that will stay with me and that I will be able to benefit from the long-term effects of. Also, the issue that we're looking for supportive environments, we're looking for supportive people, we're looking for supportive technology. So we want to be able to see in our life and environment those things that can in fact support our intentions, our ideas, our goals, our the places where we want to gravitate toward. There's also an inherent concept in wellness of balance. So it has to do with looking about at my life and my circumstances and saying, what's the balance of my time alone, time with people, issues around the balance of work versus family, issues around career versus enjoyment and leisure. So we're looking for how to balance out the various kinds of human phenomena that we all seek in different order. And we also would like to have a well-being concept at the core of wellness. So we want to not just be doing some things that are going to be beneficial health-wise for ourselves over the long haul. We also want to enrich our experience and increase our well-being as well as increase our health and medical parameters of our health. We also want to have a long view rather than a short view. We can usually take care of ourselves pretty well in the short term, but the issues really come into play in that long-term perspective. It's also one of the concepts of wellness is self-care orientation. So we have and can use a concept that says there's various things that I can do for myself that will contribute to the care that I receive and the way in which that care improves my health and well-being. There's also the issue around maximum improvement. So I can improve things, but there's also the issue of how much of that improvement can I do? And is there a limit on that that is related maybe to my genetic background or to my choice of which habits I refuse to change? So there's some maximum improvement potential. And there's also the issue of potential related to what I can actually become, or I can actually achieve, or I can actually experience. So we're really looking at the full potential, realizing some full potential. It's been called the human potential movement, but it looks at the issue of how do we, in fact, be all that we can be. Also, some constant adaptation. So the recognition that wellness means I'm going to work on my skills at being able to adapt and create healthier outcomes from the life experience that I'm faced with and experiencing. There are also the issue of small choices. These are incremental choices. They're not huge things. They are frequently, it's easy as, do I have that second dessert when I'm really feeling down? Do I let my emotions guide my choice of what I eat? So those are small choices, and it's making those small incremental choices that oftentimes adds up to a lot of what our health can become or what it's capable of becoming. There's also an inherent concept in wellness that has to do with the issue of prevention. Now, primary prevention is, from a public health perspective, is when we are working on things that are the precursors to illness and injury. So we oftentimes think about exercise as being something that reduces our potential to be either injured or to experience some type of heart disease because of our sedentary nature. So those primary are the precursors to illness and injury. Illness and injury is morbidity. So when we talk about primary prevention, we're talking about undertaking various activities that will in fact reduce the precursors to illness and injury downstream. Secondary prevention in public health terms is the issue of what can I do to detect any kind of underlying medical or condition issue that I can influence through my own behavior choices and my own choices in terms of clinical issues. So that has to do with what's called early detection. So I'm doing things like measuring my cholesterol, my blood pressure, my blood glucose, or looking at my various biologic, biochemical issues that come up in the screening of various kinds of diseases. So secondary prevention is my early detection. So I want to have that early detection going on with a primary care clinician that I trust, that is helping me to identify anything that's significant and to address it early. Tertiary prevention is, in the public health sense, is when we in fact are working on issues of prevention to reduce the adversity, the adverse sequelae things coming out of a disease condition or a disease that I have been diagnosed with, and I'm essentially trying to manage it more effectively. Diabetes would be a good example of tertiary prevention, where I have diabetes and then I'm doing things to manage that condition. So these three types of prevention, primary, secondary, and tertiary prevention, encompass about 300 different issues in human health. So what we do in the worksite is we generally focus on a fairly narrow range of those. It might be 10, 15, 20 different prevention targets that are primarily primary prevention, but some also include secondary, and some in fact can include tertiary prevention. So that's an orientation to wellness that really kind of comes out of our roots of public health. Also, the concept of being activated. Now, activated just essentially means that in wellness, we are attempting to activate people, get people activated to take action. So that activated status means they are susceptible or interested in taking action. So there's a certain kind of engagement issue and behavior change orientation that comes to us in the concept of wellness. And socially oriented kinds of issues means how is our health and our wellness being carried out in the context of social relationships and a societal orientation to that. So as we think about ourselves as individuals, we then are in families. Those families have various interrelationships. We then have neighbors and a community we belong to, a school or an employment situation or a club situation, and then out into the people that we interact with when we are purchasing things in the marketplace or when we're traveling or recreating. So it's this kind of circles of concentric circles that really are part of our social health, our social well-being. And it's also intrinsically oriented. So our concept of wellness needs to have a strong intrinsic orientation. It has to work back to the issues that have to do with why would I personally want to do particular things for my wellness and my well-being. So that's an intrinsic orientation. We use extrinsic kinds of devices like incentives to draw people into doing wellness, but we want to be working on converting that extrinsic to intrinsic reasons for whatever that health behavior related issue is. Now, the major definitional sources that we're going to look at for a definition of wellness include the National Wellness Institute. They're based in Stevens Point, Wisconsin. The American Journal of Health Promotion, the Wikipedia, the Chapman Institute, and a practical suggested approach using some of each of those. So those are the definitional sources we're going to use. We're going to look at each one individually, and then we'll talk about some of the key issues that each has or brings to the area of definition of wellness. Now, the National Wellness Institute defines the term wellness as being applied in many ways. There are many different views on what wellness encompasses. NWI, which has been one of the earliest advocates, the earliest adopters and innovators in wellness, going back more than 44 years now. The National Wellness Institute, along with the help of leaders in wellness and health, have shared many interpretations and models of wellness. Through this discussion, there appears to be general agreement that wellness is a conscious, that's kind of intentional, I'm aware of it, it's not in my unconscious, but it's in my conscious being, self-directed and evolving process of achieving full potential. So that's the first part of their definition. They also see wellness as multidimensional and holistic, encompassing lifestyle, mental and spiritual well-being, and the environment. So it essentially includes all of what we as people interact with. Wellness is seen as positive and affirming. The definition of wellness, long used by the National Wellness Institute, is consistent with these tenets. Wellness is an active process through which people become aware of and make choices toward a more successful existence. So that's the base of orientation in the definition that comes from the National Wellness Institute of Stevens Point, Wisconsin. The American Journal of Health Promotion, which I was fortunate enough to be an editor of for a number of years, is wellness, or the term health promotion, which is the one advocated by the journal. I have chosen the term wellness rather than health promotion, but the two are used pretty much interchangeably in the field of worksite health and worksite wellness and corporate wellness. Is the art and science, and that's including the provision that there's some things they're not really scientific, but they really come with the art of how this is done. That's where experience comes into play. And the science of helping people discover the synergies. That's the way in which one area supports another area between their core passions, what is of interest to them, what brings utility to them, what do they desire, and optimum health, enhancing their motivation to strive for optimal health. So we see motivation coming into their definition, and supporting them in changing their lifestyle to move toward a state of optimal health. Optimal health is a dynamic balance of physical, emotional, social, spiritual, and intellectual health. Lifestyle changes can be facilitated through a combination of learning experiences that enhance awareness. Now, this is where we come into something called the concept of AMSO. The A in AMSO stands for awareness. Increase motivation, the M stands for motivation. Build skills, the S stands for the S in AMSO. And most important, through the creation of opportunities that open access to environments that make positive health practices the easiest choice. So there's that last one is the O, or opportunity to practice. So if we think about the context of habit formation, we generally are looking at a structure that says there are cues to my habit, there are routines to my habit, and there are rewards to my habit. So in the context of the definition of health promotion and wellness that comes from the American Journal of Health Promotion, we're seeing the interplay of awareness around my health and wellness, motivation to take action somehow being enhanced, my acquiring new skills to allow me to do the new behavior, my routine, if you will, and the ability to have the issue of the opportunity to practice that so that it becomes in a deeply embedded habit and habit pattern. So we can kind of use the more recent look at habit formation as being a way to also see how the definition of health promotion and wellness that comes from the American Journal of Health Promotion has in fact taken shape. And you can read more about that in Michael O'Donnell's work at the American Journal of Health Promotion about how they have developed a perspective on this. Now, Wikipedia basically says that workplace wellness is any workplace health promotion activity, you see the term show up again from the American Journal of Health Promotion, or organizational policy designed to support healthy behavior. Now, healthy behavior then encompasses a great deal of what we've been talking about from the different definitional positions in the workplace and to improve health outcomes. So our health outcomes are either physical and or subjective issues which affect the way in which health is manifest in a given individual. Generally speaking, health promotion is defined as the process of enabling people to increase control over and to improve their health. And health promotion or wellness can be carried out in the workplace as well as many other settings. And we looked at some of those other settings: school, community, family level activities, as well as our context of the setting, the healthcare setting, and or the work site. known as corporate well-being outside the U.S. It consists of a variety of activities such as health fairs, health education, medical screenings, healthy office snack delivery services, health coaching, uh, weight management programs, wellness newsletters, on-site fitness programs, and/or facilities and educational programs. So that's the context for the Wikipedia and its definition of workplace wellness. Now, our definition here at the Chapman Institute is as follows. First of all, we define wellness as an intentional choice of a lifestyle characterized by personal responsibility, moderation, and maximum personal enhancement of physical, mental, and financial health. So our approach to this is to say this is purposeful, it's a series of choices, it's all my lifestyle collectively looked at, it's characterized by my taking responsibility for my health and well-being. It's also characterized by moderation rather than extremes in my behavior. And there's also an element of maximum personal enhancement, which means that I have the ability to be well, but you may have more ability to be well than I do in a specific domain or area. And our physical domain, where we are talking about weight and our body weight, and issues around activity, and issues around how stress is expressing itself in my physical body. Those may be all of what I start my look at wellness as including. It also can include issues of my cholesterol levels, my blood pressure, my blood glucose, and how those things are actually coming into play in my own health and well-being. Also, the mental issues begin to get us into stress and anxiety and my sleep patterns. So they can be places where I am going to express and look at wellness in a particular way. And then the financial health issue is really there because of its importance in our experience of life. So one of the issues that the American Psychological Association has found repeatedly in its surveys of the work and well-being is that the average American employee is probably most stressed about their financial health, their issues around their own personal finances. So that's one of the reasons that we oftentimes suggest that it should be included in our effort to improve the well-being of employees. Now that's the definition of wellness. When we talk about worksite wellness programs, we're talking about organized programs, which means they are not just rolled out in any old way, in the worksite or associated with working populations that is intended to assist employees and their family members. So we're trying to broaden beyond just the employee, but to include spouses and family members, which reduce their health and injury risk, or actually in making voluntary behavior changes which reduce their health and injury risk. So we're looking at health-related issues like cholesterol, like blood pressure, like blood sugar levels, and the ability to also reduce their injury risk. And we look at 4 domains of injuries: work-related injuries, home-related injuries, vehicular and travel-related injuries, and recreational injuries. Improve their health consumer skills, and where we have chosen to define wellness as including some dimensions of how well adapted people are to using the healthcare system correctly, and enhance their personal and family wellness and individual productivity and well-being. So we've essentially expanded our context here so that we can embrace many of the different areas that you saw in the previous definitions from these different sources. And our suggestion to you is you don't need to use our definitions, but if you don't have at least a definition that is adequate for what you want to accomplish with your wellness program, then these may be choices that you might want to include. These can also be the definitions that are underneath the hood of your wellness program. They don't necessarily get communicated to all of the people, but they in fact are giving influence to the way you approach wellness for your specific organization and your specific population. The source for this is our book. It's an e-book on our website. It's called Planning Wellness, Getting Off to a Good Start. So it's the idea that this is what we consider to be the core of wellness and the core of our worksite wellness programming. Now, the context around practical definition of wellness is that our employee wellness program is intended to support healthy lifestyle choices. So we're taking pieces and putting them together into a possible way of having a simple definition for employees about the wellness program, and to help create a wellness-oriented work environment for the benefit of employees and their family members. So this is a suggestion that's just a practical bringing together of the various elements that are out there in the context of a wellness program and how it might be structured and communicated to employees. So in this definition, this example of a practical definition of wellness, it basically says our employee wellness program, it's intended to support, it doesn't, mean we're going to require anything, but we're supporting healthy lifestyle choices and to help create a wellness-oriented work environment for the benefit of employees and their family members. And the context and requirements for a definition of this type are, first of all, it needs to be general enough that you can cover and put any kind of issue into the context of wellness. It needs to be flexible enough to be able to adjust to new issues that come up. So the last several decades, we've had new issues in health come into play. More recently, distracted driving has become an issue. Screen time with children has become an issue. The issues around pandemics, the avian flu and other kinds of things, those are all things that we need to address in our wellness programs, and we need to be flexible enough in our definition of wellness to allow that to happen. There's also the requirement that we have a strong emphasis on support. We are not taking responsibility for people, we are essentially supporting their choices. And that it's lifestyle oriented. We need to broaden our view to consider all those things that are part of lifestyle that have a wellness implication. And then also a sense of permanence. So what you see in the definition here is that we want to help create a wellness-oriented work environment. Now, there's no time limitation on that. We're not saying our wellness program is going to be around for 2 years. So we're going to get as far down the road as we can in wellness in that 2-year period. No, it is in fact has a sense of permanence about it. It's our program. It's intentions. It's in for the benefit of. It's part of who we are. It becomes part of our culture. And it needs to be family friendly. Whatever we can do to help people with that first order of ring that we were talking about in terms of social relationships. It's myself and then my family. And it also needs to have a cultural focus. So we in fact have in this definition a intention that is supposed to support and create a wellness-oriented work environment. That you could put the word wellness-oriented work culture for the benefit of employees and their family members. So the idea that the requirements of this to make a good definition, it should have these particular characteristics. Now, many possible domains to expand wellness over time. And some of the major ones, we obviously start with the physical domain. That's where a lot of our roots in wellness have come from, is the issue of chronic disease prevention that's based back on being able to help me understand my numbers about things like cholesterol and cholesterol fractions and issues around my body weight and my exercise patterns, my tobacco use. So there's been physical health issues in that context of wellness, and that's really why it oftentimes is our starting point. It's also gotten started because people were concerned about healthcare costs, and they thought one of the ways of reducing healthcare costs is to help more people have healthy habits. So that's where a lot of wellness has begun. We also have the interplay between our mind and our cognitive thinking processes and our physical health. So we can be very stressed depending on what our thought life is like or what our self-talk is like in our mental activities. So the stress related, anxiety related, why am I doing this stuff? What's my purpose? How do I relate to, things that are around me? Do I have a doctor? Do I feel it's important to be monitoring my health in any way? All of those kinds of issues. The financial comes into play in terms of understanding the benefits that are provided to me to protect me financially, and also the decisions that I make in managing my financial resources. How do I finance college for my children? What do I do related to preparing for retirement? How do I secure from any threats my assets? What do I do related to emergencies? What if I'm not able to work for 6 months? So how much of an emergency fund do I have? There are a lot of those kinds of decisions which come into play when we think about an individual's wellness and well-being. And the emotional side of life. What are my feelings? How do my feelings interact with my food activity or with my drinking activity? How does that come into play in terms of the issues around my own wellness and well-being? Social issues have to do with we are social animals. It's not good for us to be alone. So the idea that we want to have those relationships that can help us and we can enjoy, that's a part of our own wellness. The cultural issues have to do with what's my exposure to culture? What are the norms that guide my own choice of behavior around self-care and around my wellness and well-being? What cross-cultural experiences do I use to enrich my life? So there are a number of cultural kinds of concerns. Intellectual has to do with how do I maintain my intellectual health and well-being? What do I read? How much sleep do I get? What kind of what kind of people do I hang out with? What are they thinking about? What are they challenging me to learn? Those are all intellectual related. Professional has to do with what is it that I am oriented toward becoming in terms of my career? Where am I headed? What path am I on related to my professional development? And the spiritual has to do with my sense of purpose. What brings meaning into my life? How do I see myself in relation to other human beings and to a God or gods that I choose to worship or to recognize? So those are issues that have to do with more of the reasons behind my life, the circumstances and purpose behind my life. And finally, worldview has to do with how do I help people in a wellness program actually get clearer about what beliefs they have and how do those worldviews actually work out in terms of their day-to-day choices. So I can deal with issues that have to do with materialist worldview, secular worldview, Christian worldview, Islamic worldview, Buddhist worldview, Baha'i worldview, Hindu worldview, Shinto worldview. So it is the collection of my beliefs and how they help me sort out the various choices and issues which characterize my life. So many possible domains to expand wellness over time, to the people that we are attempting to serve with wellness programs. Now, the goals of wellness programs are also going to be important in our definitional base. So if we want to have employees engage and actively participate, that's usually one of our unspoken goals. It probably can be a formal goal as well. We want to improve employee health. So there are measurable ways we look at human health. Do we want to be able to see some improvement in those? We maybe want to reduce the health risk prevalence, how much of those health risks exist in the population, and the severity of those risks. So I can have a low severity, I can have a moderate severity, or a high severity. So I may be concerned about those, particularly as they lead to potential other kinds of conditions and diseases. And we may want to reduce the growth of health costs. Maybe those health costs are limited to our health plan, or maybe they should include sick leave absenteeism or workers' compensation costs or disability insurance costs, short-term and long-term, or presenteeism-related losses and costs, which are a portion of the lost productivity when I choose to stay at work when I've got an underlying health problem. So I have to choose which of those or what combination of those I am working on in terms of the wellness program's purpose and intention and methods. We also want to generally save money for the employer. So if that's our orientation, then we're going to structure our wellness program and address topics that are going to help do that. We can also want to enhance productivity. So if we're a employer and we're considering doing some things in wellness, then we frequently want to enhance the productivity of people that are employed by our organization. We also want to satisfy employee needs. So the employees have certain health needs and health and wellness and well-being issues and needs, and we may want to formally satisfy some of those needs. We also want to improve retention and recruitment. So oftentimes our wellness programs can have a goal of improving people's staying with our company, feeling like it's the place where they want to be, and recruiting new people, good people that can help our organization be successful over the long haul. So these are the issues that have to do with the goals of wellness programs. They should in fact affect our definition of wellness. So if we're oriented toward any of the economics of health, we need to make sure that our definition of well-being and health and wellness is in fact consistent with that purpose. So our goals of our wellness program are going to help us shape the definitions we use to address wellness in a given population. Now, our recommendation, the Big 8, and these are the areas that we believe are a good choice for virtually all wellness programs. So the issues are tobacco use, and even though we're down into the high teens in terms of tobacco use or smoking, actually smoking behavior, not tobacco use, but smoking behavior in American workers, we still have that issue that affects a lot of disease conditions, which you can see, and some continued possible interventions in terms of helping people with those kinds of activities. Nicotine supplements also being a whole nother potential intervention. Physical activity is probably what we call one of the key gateway behaviors. It's oriented and affects a number of these issues. So physical activity will probably always be a part of what we need to be doing in wellness, and it's helping people with those disease and conditions that you see that are identified in the table. And walking programs, fitness facility, wearables that are used to encourage physical activity, those are all possible interventions for that particular target. The focus or target of nutrition and healthy eating oftentimes deals with the diseases and conditions that you see listed, and the possible interventions again that we use to help people with nutrition and nutrition choices. Heart health is the fourth of the Big 8, and that usually includes the cholesterol, blood pressure, and we do testing. We oftentimes will help people with interventions that are designed to help get, lower blood pressure or rearrange the fractions of cholesterol and their measurement in the individual's body. And then they're also looking at the hypertension, hypercholesterolemia. Weight management is the fifth one, and that's a problem that we experience in terms of about 2/3 of working adults in the US are either overweight or obese, and that's got a lot of health-related consequences attached to it. So again, you see some interventions in the table. Stress is a general issue in health. It is associated with those conditions and issues that you see listed in the chart. Also, the possible interventions can be multiple and different, but they're described as stress management, resilience education, lots of different other interventions to be able to do to affect stress. Exercise, for instance, will reduce personal stress levels. So I can, in fact, if I'm careful in my caffeine ingestion and my nutrition, I can also reduce some of my stress experience. So there are interrelationships that exist between these big 8 targets and how we approach them. Back pain is one that you don't see as often in wellness programs, but the reality is according to the National Health Survey, about 75% of us experience some sort of back pain event within a 2-year period. So we have that as a common problem that's out there. And it's, again, associated with chronic pain syndrome, sciatic nerve development or involvement, but issues around back pain. And then possible interventions being our physical conditioning, lifting techniques, resistance training, ergonomics. There are a variety of different areas. Back pain is on here partly also because some of these other areas, the 6 that are above back pain in the chart, tend to have longer lead times to show economic effects. So we oftentimes are preventing chronic diseases, or we're lessening the severity of chronic diseases. Therefore, it takes a while for it to work out in terms of healthcare costs and reducing those. Whereas the back pain issue is a quicker economic hit, if you will, in terms of health plan costs. Medical self-care is the whole area of helping people with physician-derived and scientifically derived help at making choices about what to do about the common self-limiting symptoms that we experience as human beings. According to the National Health Survey conducted by the National Center for Health Statistics, the average adult over the age of 18 worker in the US experiences 2 or more personal symptom events each month. So that's 24 symptom events each year. And we oftentimes then choose, do we ignore it? Do we go to work? Do we stay at home? Do we go to our physician's office? Do we go to the emergency room? Do we go to the urgent care clinic? Do we go online and go to webmd.com? Those are all choices that people make around those symptoms. And then some of the diseases and conditions that those symptoms are associated with, you can see in the chart, and then also some possible interventions. So the last 2, back pain and medical self-care, are intended to produce quicker economic effects on our health plan cost. And we are attempting to balance the longer term issues that are the first 6 with the last 2 of the big 8, which tend to focus on a shorter time frame for the effects on healthcare costs. Now, there are different ways of doing wellness, and we would be remiss if we didn't introduce that concept here. So that we're talking about a feel-good wellness that has those main features that you see. The HCM is health cost management, so it's not doing much to change the pattern of expenditures and utilization in healthcare. It's primarily a morale-oriented approach to wellness. The next kind of strategy or program model of doing wellness is what we call the traditional wellness model, and that's more of a smorgasbord model. It's putting a whole bunch of activities out there and hoping a lot of people do the activities. So its main features are identified. They parallel as you read across the models. And then this is more activity oriented. We're doing head counts. We're talking about the numbers of people that are involved in various wellness activities. The results-driven wellness is the next model or strategy, and that's where we are actually becoming more strategic in our approach to wellness, and we're becoming more powerful in terms of the methodologies and interventions that we use to achieve behavior change and health improvement. And that tends to be more of a results-oriented approach toward wellness. So our approach to wellness needs to also line up with the model or strategy that we're using around wellness for a given population. The important implications of a definition are that definition will tend to have relationships to resources. So if our definition has a narrow scope, it will tend to have a limited and require a limited resource base. So if we go with a broad-based definition and we're looking at expensive types of interventions, then our resource base needs to be greater. It also has an implication for targeting. So our issues around how we define wellness will in fact affect how our targets are selected for the populations that we're working with. There's also the issue of the choice of definition and the inherent or innate goals which are identified through that definition that become part of what we pursue. So we can have explicit goals, and I recommend that each program have at least 5 to 8 explicit goals around wellness and 5 to 8 explicit objectives around wellness. Objectives are a time-limited, slight stretch, measurable, achievable, and assignable to a specific individual, whereas goals tend to be less able to be measured, but they're pointing more in a general direction for us. Activities are going to be a key implication of a definition. So if our definition of wellness does not include early case finding or secondary prevention, then we're not going to end up putting that into our program usually. So the definition itself will guide a lot of our choice of activities. It also has a lot to do with our likely results. If we are simply trying to achieve reductions in our medical trend for our employees on our health plan, but we're not using any of the broad array of other ways of shaping healthcare costs, then that's likely to not give us the results that we want. So our likely results are a key and important implication of a definition. It also has to do with expectations that management has. We can't do wellness in a feel-good model and expect it to produce a results-driven wellness set of results. And also sequences, what comes next, how things are laid out, has a lot to do with which things we've emphasized in our decision and our definition for wellness. And then also it's got implications for cycles. We want to have some cycling activity going on, and that does not mean bicycling. It means cycles of processes where we are helping people become aware of health issues. We're helping them become motivated to pursue change. We're helping them to acquire the skills that go along with that new behavior, and to have opportunities for them to practice it long enough for it to become the routine that is part of the healthy habit. So those cycles of activity really stem back to our approach to our definition for wellness. Now, the summary of key points in this particular module are: many worksite wellness programs suffer from unclear or inadequate definitions of wellness or well-being. Your definition of wellness should be consistent with the major goals of your program. Your definition needs to be broad enough to allow new targets and address unforeseen issues over time. So we need to have that openness of our wellness definition to be able to address those new things as they come up. The core concepts embodied in your definition are very important. So those key concepts and core concepts need to come back to them and make sure that our programs are aligned with them. The practical aspect of what behavioral targets are addressed by your wellness program are of primary concern. So that's the issue of what are you going to address? What kind of activities, actions, outcomes are you focused on? And there is general agreement about what wellness or well-being means and what prevention targets should be addressed. But there's limited consensus on the combination of interventions that virtually all programs should have. So we have some general kinds of agreement among programs about wellness and what targeting should be done. But there's limited consensus on what combination of interventions are best for my population, for my organization. Be prepared to modify your approach to wellness and well-being periodically to add enrichment and novelty to your program. So we want to keep kind of adding new dimensions to the wellness issues, not leaving out or leaving behind anything, but essentially adding to it or enriching it and giving people an opportunity to experience that enrichment. Your program's goals should influence the choice of the behavioral and health targets you choose. So your purpose for the program needs to give you essential direction on what you should be doing in your program around the issues of wellness and well-being. So in summary, these are some of the key points from our module on the definition of wellness. Now let's answer some key questions on this particular issue. First of all, why is the definition of wellness important? And I think it's important because it has implications for the carrying out the design and the conduct and the implementation of your wellness program. It also, secondly, sets the stage for how expectations are developed among your senior staff, your senior management staff, but also from your rank and file employees. So the idea that definition of wellness is important for both the set of expectations as well as the actions that you take in your wellness program. In addition, it oftentimes is our starting point when we want to do evaluation. So if we have a definition of wellness and we come to that and we ask the question, how well is our wellness program doing itself? Then the definition of wellness is really a very important starting point for that whole evaluation process. And the fourth thing is that it allows us to be able to be very tangible, concrete, and practical and pragmatic in our approach to activities under this general heading. So we need to have that definition help us do those things. Second question is, should we define wellness in a very narrow or specific way? And I would generally say no, don't define it in a very narrow way, because that leaves new things that come along not able to be put underneath the program very effectively. So this should be an area that has some flexibility, it has some dynamism in it, it has the ability to address new kinds of interests and needs which come up in the population. It should be in a flux situation, a fluid situation. So we don't want to define wellness so narrowly that we actually make it not accomplish perhaps some of the stated or unstated goals which are associated with the program itself. Third question is, how do we get from the definition to actual program activities? And I think the best way of being able to do that is to look at the components of your definition and then begin to ask the question, what are goals which relate to this component? What are our objectives that might relate to this? What are activities and interventions which might relate to it? So you're starting with taking your definition and actually operationalizing it. Now you can work back the other way. You can actually say, here's what I want to do in wellness as the set of activities. Now I'm going to define wellness after looking at what I want to do. And that is what some people do. The downside of that is that unless you have some fairly strong alignment with senior management and the way in which you approach wellness, you can get into difficulties that your wellness program does not align with perceived informal and formal goals and objectives that management has, and management has control on the funding and the approval and the authorization, the authority for you to do the program. So that's what I think makes sense for us to actually think through what do we want to do with this whole area with our workforce, and then have that come out as an expression of specific activity that really gets put together in our work plan of what we do for that wellness program. Now, you've completed this particular module, so go ahead and take the quiz.